Hey mamas, you're listening to the Balanced Working Mama podcast, the only podcast teaching you how to balance your work, motherhood, and wellness. I am Dr. Amber Thornton, clinical psychologist and mama wellness consultant. Each week we dive into tips and strategies and much more so that you too can become a balanced working mama. Let's dive in. Hey mamas, welcome to the Balanced Working Mama podcast. This is Dr. Amber, and I hope that everybody is doing well, having a great day. And I am glad that you found your way to this podcast, either for the first time or again. This podcast is for you. You are welcome here. I'm so glad that you are wanting to go on a journey of finding more balance in motherhood. I love it. I love it. I'm so excited. And I'm also really excited for today's episode, y'all. So, we have a special guest on the episode today. And this topic is one that I think so many of you all will receive so much value from. You will get so much from this episode because we are talking about unlearning the strong Black woman schema. And I think that is just so relevant for so many of us because I know many of you all listening to this are Black women, Black mothers, but also I know some mamas that listen to and love Balanced Working Mama might not identify as Black women or Black mothers, but you know Black women, you know Black mothers, you are in community with other Black women and Black mothers, but also learning about this can inform your journey as well. So I am so excited to have Dr. Cecily Moore come and talk to us about her research. She is actually researching and studying this and had some time to share it with us. And I am so glad. So you all sit back, really dig deep into this episode because it is definitely going to have you really thinking and reflecting about your own experience of motherhood. It's going to have you thinking about your mother's experiences, your grandmother's experiences, and how these schemas of being a strong Black woman continue to manifest in our motherhood journeys and how we can also begin to unlearn them. So, y'all, let me know what you think after you listen to this episode. Share it with me on Instagram. Share this episode with another mama that you love. But let's get into the episode right now. Hey, mamas. So we have another very special guest today. I think that this guest has been on the podcast at least one other time. Either way, I'm so glad to have her back. She's a past Empower Wellness mama. She's in our community. So I'm really happy that she has been supporting Balanced Working Mama for so long. Either way, I want to introduce Cecily to you. Cecily, please share with us who you are, a little bit about yourself, but then also what we're going to be talking about today.
Yes, so I'm Cecily Moore. I currently live in Fort Walton Beach, Florida, with my 5-year-old daughter, 2-year-old son, and partner. Among other things, being a mom and a wife, I am a student, I am a counselor, and most importantly, a recovering strong Black woman. So that is the topic that we will be talking about today.
Cecily, I didn't expect for you to kind of just bring it in like that. When you said recovering, I was like, oh shit, what is she about to say? And I was like, okay, yes. So yes, I'm excited to talk about this. And actually, since you just kind of took us there so immediately, can you share with us a little bit about why this is something that is of interest to you? And I'm assuming it's because you are a recovering strong Black woman. So what does that even mean? Why does this matter for us? Tell us how you got into this and what this really means.
Yes. So my interest in the research part of it came from my own lived experience. After I became a mom, my entire identity shifted, and I don't feel like anybody had prepared me for it. And so I started researching all the things, reading all the books we often do whenever we become pregnant. But then looking at the historical context of birthing, midwives, doulas, the necessity of it. And so though I felt prepared to bring a child in the world, I wasn't prepared for the identity shift that was going to happen. And so my experience with postpartum depression is what kind of propelled me into this research. And so once I realized that it was postpartum depression, like my friends and family were like, "You're a therapist, girl, therapize yourself." And I was like, that's not a thing. First of all, that's
Really
not
not a thing. Not a thing.
right. But it forced me into an identity crisis. It forced me to look at my mom, my grandmother, my aunts, and like how they had handled it, because I realized like what I was experiencing. I had seen it before, but there wasn't anyone talking about it, or anything like that. The other thing is, people tried to normalize my suffering in postpartum depression and like almost frame it as a rite of passage. Like, this is what you have to do to be a good mother. And I have a lot of rebellious energy. So I was like, hell no, like, this ain't it. And so what I realized is that my internalization of being a strong Black woman had created an environment and a lifestyle that was no longer sustainable for who I was becoming.
Wow.
And so, of course, as a researcher, as a PhD student, I was like, oh, we're about to figure this thing out, because if I'm experiencing it, someone else is experiencing it. And I'm really big on Black women creating theory and solutions for themselves. And so I wanted to be a part of the solution and not the problem.
Oh, that's deep. Oh, that's heavy. And I just started thinking of all these things. Like the first thing I thought of is like, this is why I love Balanced Working Mama so much. And truly, our community is a diverse community. It's open to anyone who feels aligned with what we're doing, but it truly, truly is absolutely made for Black women in mind, because I know that we struggle with this so much. If there's a very unique experience that we have, like you're saying, and like you're going to share with us even more, where it's almost like there's this rite of passage where you have to suffer in order to be this woman that is then like put on this pedestal after you've beat yourself down trying to take care of everybody else. Like that's how I think of it. It's like
Yeah.
it's like that's the literal visual that I get. And so many of us, like you said, and this is my experience too, we've seen women, our mothers, our grandmothers, basically be this strong Black woman. And it's like this very like honored thing in our culture. But now our generation is kind of looking at that and saying, immediately no, like absolutely not, like no, not no more, no more. And I think we need extra help with that, because it is so embedded into our culture, our being of what it means to like supposedly be a Black woman or a Black mother. Wow. Like, and I don't even think like I'm thinking of, so the other thing I was thinking about is, and I think I talk about like my experience with like my mom and my grandmothers a lot on the podcast. And I don't even think I've really specifically connected it to, this specific experience of like the strong Black woman phenomenon. Like, I think that they took on, and I think that's a huge part of it. And like you, I have a little bit of a rebellious spirit where I'm like, no, I don't want to do it. So I'm so thankful for people like you who are doing this research and talking to us about this. So I want to know, and I know the mamas want to know who are listening to this. First of all, so is it called strong Black woman? I've heard people say syndrome. I've heard people say phenomenon. I've heard people say, I don't know. How do you say it? Like, what should we call this thing? And what are the characteristics?
Strong Black woman schema. However, phenomenon, syndrome, archetype, stereotype, all of those are correct. When I started doing the research, I went back to the genealogy of where it started, and it's taken on many different names: Superwoman syndrome, Superwoman schema, the Black matriarch. Like, all of those things originated out of this. It originated in slavery. And so we're just calling it a different thing, but it all means the same thing.
That's helpful to know. And so it doesn't matter what you call it, but just know that this is what we're talking about. And it's so helpful to know that all of it is all connected, because you're right. I hear like the superwoman
Mhm,
complex and like
mhm.
it's all goes
It's
back to the
all
same.
connected. The Sojourner syndrome, the Sisterella complex, all of it
All
is
of it.
used to weaponize strength in Black women.
Oh my gosh. And so what are the characteristics of it? Because we're talking about it. What does it look like? Like how is it manifest? Like what is it?
Yes. Um, a showing of independence, so much so that we become afraid to ask for help, and not even afraid to ask for help, right? It's just the thing that we don't do because of how we might be perceived, and because we saw other women who did it and didn't ask for help. Being known as the caretaker, not only for your family, but also for the community. So the mother who does it all, who's always on call, raising children, sustaining her household, working both inside and outside of the house, hardworking, high achieving, always known for overcoming adversity. Like that's kind of like her staple. She's emotionally contained, and so she suppresses her emotions and she takes care of other people to the detriment of herself.
Wow. I'm getting chills. um I have so many thoughts about this. Like this, this might need to be a whole series in the community or something, because like I am just thinking about how why it's so hard for us to break away from this. And it's because like all the things you just said are the things that make you, what are the words I'm trying to say? Like um you
It's
receive,
honored.
yes,
It's
that,
honored in our culture. It has become a
yes,
cultural identity and a rite of passage to be
exactly.
strong, but it's to
Yes.
our detriment.
That's exactly what I was trying to say. It's like all those things is how you become like big mama.
Right,
Or like
right.
I didn't know how to say it, but like that's who they are,
Yes,
like that's
you said
them.
it right. Those that know, they know. Yes, that's how you become
Like
big mama.
that's it. And you want to be that, like the strong like matriarch, like that's that woman, like that woman. And we all have that woman in our family. She's the one that everyone loves, everyone goes to,
Yeah.
like nobody disrespects her, like and so it's like it's blowing my mind to think that she, who on the outside we're thinking is like this super strong, revered, the woman that, is your goal to get there, but she's got to go through all this shit.
All of it. She's got to push through and deal with it.
And it's almost as if I think we always thought that she just didn't go through things, or maybe we just didn't care enough to consider what she was going through. Like, I don't,
I think it's a combination of it, right? Like you see somebody handling it, and I tell my clients all the time, like
Mhm,
this is our responsibility to fix, because we've conditioned people to
mhm.
think that we're independent and we can do it on our own. And so to reverse this thing, we're going to have to start articulating our wants, needs, and desires. Ain't nobody coming to save us.
Wow. Oh my gosh. And again, like I keep thinking about balanced working mama because it essentially
Mhm.
looks like the opposite of that. Especially when you said the woman that is like emotionally contained. Girl, look,
Mhm.
I'm always like express your feelings, even if it's
Yes,
ugly.
yes,
Like tell them how you feel. Like
yes.
do what you need to do. Absolutely not. Like, and it's just so I have a question for you, because I know that earlier you kind of mentioned how a lot of this goes back to slavery. And
Mhm.
so in my head, I'm thinking, is this something that like specifically only happens to Black women? I guess I want to know a little bit more culturally how this manifests specifically for Black women. Like why Black women?
Yeah, most definitely. Why Black women is because it was used as a justification for the torture that we received. So if you look through different decades and centuries, when we talk about the Black matriarch, that was used to weaponize the Black families and justify the separation of Black families. When we talk about the welfare queen, right? Like all of these different stereotypes have taken on a life of their own, but been used to weaponize Black women and make them responsible for oppression, really. And so the way in which it manifests for Black women is psychological distress. I did a presentation on the things that our aunties and grandmas used to say, you getting on my nerves, I'm tired of being tired, like all of the colloquial terms, when really and truthfully, they were talking about anxiety and depression, right? Poor health outcomes, diabetes, my sugar too high, heart disease, like all of these things that we have really kind of not placed reverence on and really talked about in our community. It's a direct manifestation of the strong Black woman schema. Performative strength, for Black women experiencing depression, it don't look like what the DSM said. We dress up our stress so it looked like strength. And so that's performative, right? And ultimately, it's a disconnect from self-knowing. It's a disconnect from being able to articulate like what your wants, needs, and desires are and how we go about achieving that.
Oh my gosh. I don't know why this is like really, because I hear this stuff, I know this, but this is really like it's hitting me in a different way, and it's just mind blowing. And I love what you said about, you know, those those phrases that we always remember, like our aunties or our grandma saying. One thing my grandma always used to say, like I distinctly remember my brother, girl, my brother reminds me of my son, like just off, always on the go, does not stop messing up stuff. And so my brother knocked over her plant or something, and I think it broke and the soil got all over the place. And she will always say, I can't never have nothing nice. And so I don't know if nobody else's grandma said that, but my grandma
Yes.
will always say that, like, I can never have nothing nice.
Yeah.
And so like when I think about that now, it's like, damn, she must have really felt like she, you know, couldn't have nice things, or like, you know, these things that meant so much for her were always, you know, taken away from her, something like that. So that absolutely resonates now. It feels like there was something deeper going on where maybe she wasn't satisfied. Maybe she wasn't as happy as we thought. Or like you said, like getting on my nerves, or like my nerves is bad, like anxiety. Nobody was saying anxiety back then.
Nobody was saying
They were saying all these other things.
Yeah.
My nerve pills.
My nerve.
Nerve pills.
Yeah.
You mean to tell us they were taking Xanax back then? Like, I don't know what it was, but
Yes.
nerve pills.
Yes.
Anxiety. And so it just, wow. Like, I love that our generation is kind of like rethinking about these things and wanting to break away from some of these things. And it's so hard. And so I want us to talk about the barriers, because I know that mamas listening to this are thinking like, oh my gosh, I can so relate to this. This is identifiable in myself, in my mom, in my aunties, my grandmas, but how the hell do I break away from it? And we're already talking about one of the barriers is that it's so culturally embedded into, you know, who we were taught that we are supposed to become. And so breaking away from that cultural tradition is really hard. It can make us feel empty or like a void culturally, like just, it's really hard. So I want to talk about that part and get your thoughts on, like, what do you feel are the barriers for women like us who are now trying to really separate from this strong Black woman schema that is truly all we've ever seen?
Oh yeah, most definitely. The first thing I think about is access to care with culturally competent clinicians. Finding culturally competent clinicians as a therapist, right? Like that is like moving mountains. pathologizing strength. I think a lot of times when we're not in company of people who don't understand the schema, they weaponize strength and it becomes an issue for us. And oftentimes we stop going to therapy, we stop seeking help, because how do you tell somebody, I'm going to take away this coping skill that has been used for survival, especially even now in times of ongoing oppression? And so we've got to figure out how not to pathologize it. My personal suggestion is reappropriation of strength, but that's a whole nother conversation. Sometimes it's our religion, what we've been taught through the church, but you can pray and go to therapy. The inability to prioritize self-care, like the guilt that comes with practicing wellness. And then the experience that society says that we have to be all of these things. I think there's a lot of social conditioning outside of our families about Black womanhood. And so with those societal expectations, I think it makes it even more hard to seek the help that we need.
Yeah. You said so many things again that are just so relatable. So, and of course, when you said the wellness piece, my ears peaked because I was like, yeah, I think that's another reason why balance for mama is so important, because so many of us are having such a hard time prioritizing wellness. And it makes sense that it's connected to this, like this guilt that we feel. It's like, who are you to think you deserve wellness, or like,
yeah.
And that sounds so harsh, but like that's truly what goes through so many of our minds as we're even thinking about it. Like, what do you mean? You don't deserve this? You don't need this? What do you mean this is not a priority? Like we are constantly combating, those thoughts about taking care of ourselves constantly. There are two things I wanted to ask you quickly. I know that one of them you said it was a whole other conversation, but I know you keep saying weaponizing strength. So I want you to explain that, but then also you said reappropriating strength. What do those things mean?
Yes. So I think that whenever we are sitting across from a clinician or we're asking for help, and what we are using as strength, our coping skills, we may be battling depression, but for Black women, oftentimes depression is functional, right? We're still going to work, we're still doing the things, we're still taking care of our family. And so a lot of times to have someone sit across from you and not understand your personhood and your lived experience and just want to put a label on you without taking into account all that is happening in the background can weaponize your strength and further creates an identity crisis, because this has become a part of our identity. When I talk about reappropriating strength, I'm talking about this schema came out of slavery. It was not meant for our good. And we can't rely on the oppressor or the person that created it to save us. And so it's going to be up to us as Black women, as a collective, to reappropriate it for our good, to practice wellness in a way that combats these adverse experiences that we're having. And so, for lack of a better words, we got to save ourselves. We've been doing it for everybody else.
Yeah. And now flip it. And it's us now.
Yeah.
And you're right. We have to save ourselves. In the way that I'm thinking about it, and you tell me if this is how I should be thinking about it, we have to do it ourselves because everyone around us has become so dependent upon us being the strong Black woman. And so while they love us and care for us, they might want to save us, but they might not be able to, because it's like a codependent relationship with like our loved ones, but then also society. Society is dependent upon Black women showing up as the strong Black woman, no matter how you feel.
Yes.
And so society cannot help us. Our loved ones cannot help us. We have to make the decision to hear this information and say, okay, what am I going to do differently?
Say it louder for the people in the back.
Assuming I got that right. Okay, good. I got that.
Yes.
And that is why I think community is so important. And
Yes.
it's just, I'm loving this conversation truly, because like, the things that I do with Balanced Working Mama, I care about so much. And sometimes I don't know why I'm doing them. I'm just know that it's helpful. And
Yeah.
so this conversation honestly is really like connecting some of the dots for me. It's like, duh, this is important, because this is what we're
Yes.
trying to do generationally. Like
Yes.
generationally, like it's on us to undo these things. But
Yes.
also we have to do it in community, because we're also talking about how hard it is to undo it, because nobody's going to help you, and not because they don't want to, because they cannot.
Yes, oh my goodness, exactly. And I tell people all the time when I talk about Balanced Working Mama, like it was the catalyst for my own experience and research with this. I don't even know if you remember that first conversation we had where I was like, I live in this military town and I'm just going to isolate myself. And you were like,
Yeah. And I was like, that don't sound right, but I'm gonna just
yeah, that
I'm gonna
don't
let
sound
it
healthy. And I was in a dark place. Don't get me wrong. But what I realized though, like what you are teaching in Balanced Working Mama is breaking generational curses. And it's going to be up to us, especially as mothers, to demonstrate and model that for our daughters and for their daughters. And so it starts with us. Like we are the trailblazers. We are creating a new narrative.
Wow.
I know it's heavy.
It's heavy, but heavy in a good way. Like, well, not a good, it's heavy, but heavy like, I'm so glad that we are all, working together and supporting one another to break these curses. And it's hard to be responsible for this. But I know, and so the thought that I had when I had that deep sigh was like, sometimes I feel like in the midst of trying to undo all these things that like generationally, not even my fault, but I'm trying to
Right.
undo them, I feel overwhelmed at like, oh, I'm not even doing it right. You know what I'm saying? So sometimes just the burden of like knowing it's on me to undo it. But then I remind myself, me just even having the awareness of trying to
Yeah.
unlearn these things is great. And like
Yeah.
me trying and showing up every day is amazing. And Eden
Yeah.
is going to see that hopefully and say, okay, mommy carried the torch this far.
Right.
I'm a carry it even further.
Exactly.
Okay.
Yes. Awareness
So
showing up every day. Yes. Yes.
yeah. So, oh my God, like this is blowing my mind. Is a really good conversation. So I have a few more questions for you. We've already talked about the barriers and why it's hard to undo or break away from this strong Black woman schema. But now I want to talk a little bit more about what are some strategies we can use for really ensuring that we don't continue to carry on this schema. Because I think, again, many of the mamas who are listening, they are in agreement that they've seen this, they can identify it in themselves and other women they care about, and they don't want to continue to carry this on. But what are some strategies that might be helpful that they should keep in mind?
Yeah. Awareness and truth telling, like really being able to say what the schema is doing to you and how it's impacted you, right? And like being able to sit with yourself. Begin to think about what it means to reappropriate strength and re-envision what redefining the schema would mean for yourself. Obviously focusing on wellness, understanding that it does start with self. You can't pour from an empty cup. Stop suppressing our emotions first and foremost. And then, just unlearn that shit. We have been conditioned to be strong. It is time to unlearn that shit and give it back.
Wow. Oh. This is so good. I'm just thinking, and again, I think of myself as one who's like actively engaged in this type of work. And still, I'm hearing this stuff and I'm like, wow, there's still more work that I need to do. And I'm excited to continue this work. And I love that, I have people like you that can kind of like keep pushing this along. I cannot wait to read your dissertation, by the way. Like, just know I'm going to be a reader.
Love it. Thank you.
Because this is amazing. And so Is there anything else you feel it would be important for us to know as we continue on this journey of unlearning the strong Black woman schema?
Yes, being a strong Black woman was not meant for our good. It was created by our oppressor, and upholding that schema is dangerous to our being. And
Mm,
so it is going to be up to us to save ourselves and to unlearn that shit. And it starts today. Like once you have the awareness, you can do something with that information.
wow. Oh my gosh. Thank you, Cecily. That
Um,
was so good. I am so grateful for you. Thank you for coming on to talk about this. I feel like I should just have you on later in the future to talk about it more because I feel like this definitely needs to be a continuing conversation because I think this is great for really getting our listeners to think about this and become more aware of it. But I want it to be something we're actively engaged in at all times. So thank you so much, so much. Where can the mamas connect with you?
Yes, on Instagram under Dr. Cecily Moore. I'm not as visible as I should be because I'm writing a dissertation. Nothing will get in the way of me creating this framework. So I'm out there, I'm lurking, I'm watching. But I think that there are some big things in store come fall 2022 once we get this dissertation in this framework. And I can't wait to share it with the world.
Mm. Wow, we're so excited for you. We cannot wait. Please connect. Thank you so much. And this was amazing.
Thank you. Yes, I enjoyed it. Thanks for having me.
Hey, Mama. Thank you for listening to the Balanced Working Mama podcast. If you love this podcast, please be sure to rate it and share it with another mama that you know. And don't forget to follow me and Balanced Working Mama on Instagram. I'll talk to you soon.